some of the results from our workforce data. And
hi, I hope, can everyone hear me? I'm going to just share my screen. My name is Annelies Goger, and I am a Rubenstein Fellow at the Metropolitan Policy Program at Brookings Institution. And my background is generally in workforce program evaluation nationally. And last summer, I did an analysis of the Pearl data, which is the data that's reported to DOL about WIOA program participation. This will focus today on the adult program because the data is from PY 2018 Q3, which is January 2019 to March. And I'm going to focus on adult because at the time dislocated worker program participation was quite low, which actually might be different right now. So just to keep that in mind. But I would say that nationally, the data for adults and dislocated workers wasn't that different. So it's just easier and better to present one data set here. So I'm going to share my screen. So here's, bear with me for a minute. It's really a pleasure to be here today. And I'm curious, I'm going to talk pretty briefly so that we can actually have more of a conversation about the data. I think it's more interesting. Just for context, my colleague Martha Ross produced a report a couple of years ago, which is based on data from the same time frame that you'll see the WIOA data. There are 53 million low-wage workers that she estimates in the United States, or about 44% of the workforce overall. And she did her analysis by MSA, so I just picked Birmingham, and I found about 168,857. So it's slightly lower percentage-wise than it is nationally. The overall workforce in the Birmingham MSA in her table was about 427,000. The earnings are, however, slightly lower for the low-wage workforce. Just to give you context, I'm just trying to set the stage for when you look at the numbers for WIOA, you can like kind of situate it in context. And also statewide, it's worth noting that there's about 2.8 million people in the labor force between 16 and 64. The other context I wanted to set, if you're looking at Alabama in the broader sphere, are my colleagues, Mark Muro, wrote a report about potential for automation. And it does seem to me that Alabama, I know it's kind of hard to see the state boundaries here, but has a pretty high automation risk relative to other counties in the country. So I just wanted to note that in terms of the low wage workforce and where Alabama is positioned nationally. So I'm not going to present outcome data per se. I think probably you've all seen that. What I think is really more interesting for people to see is just an overview of like, who are we enrolling in WIOA Title 1B programs? What kind of programs are they enrolled in? Is this the balance that you want to see? And that can be the basis of a discussion. The share of training versus career services is actually almost equal. Slightly more are in career services alone, meaning they didn't go to training. This is different from the national picture where about 21% of overall WIOA participants are in training. That could likely be due to a state policy or state law. But that's basically how Alabama compares. The other thing to note here is that the total number of exiters is compared to the share of the low wage workforce is quite low. And that's largely because WIOA allocations are so small. A lot of people do receive training or career services elsewhere outside of WIOA Title 1B programs, obviously, probably the largest being community college programs. in the WIOA Title 1B adult program, Alabama has puts most people into occupational skills training. And what that means is you're getting basically classroom education that's not work-based or, some kind of like apprenticeship or other type of training. The other thing to note, which is different from the national picture, is that the forms of on-the-job training that Alabama does are leading to lower earnings than the occupational skills training. We actually found the opposite nationally, where if it was a work-based training, generally customized or apprenticeship in particular, those had more than doubled the earnings of the occupational skills training. Although it doesn't look like there's anyone enrolled in occupational skills training or apprenticeship in Alabama from our analysis. The most common industries, this is just like kind of a high level industry category, but hospitals were number one. That was different from the national data, which had employment services as the highest, which is interesting because you'll notice the difference in median earnings. And I'll talk a little bit why I think this earnings is also quite high for Alabama in a minute, but it's a good thing that you're not putting people into temp agency jobs, I think. The occupations of training. So the last graph was all participants where they're placed, right? This is just training participants and what kind of occupations are they getting training in. So the most common is truck driving licenses. It's important to keep that in mind in the future because as I said before, likelihood of automation is high. And so that's something very relevant to truck driving, I think, maybe not in the next 2 or 3 years, but maybe something to think about in the long term. The second is registered nurses, which is different from the national. Nationally, registered nurses are the second most common, and the second most common they're the third most common nationally. In the country, CNAs, certified nursing assistants, are the most common, which is the fourth here. And as you'll see also here, the earnings for CNAs are very, very low. The hours are also unstable. These are generally not great jobs as they currently exist in the US. And they're really hard to move. It's hard to move up in them in many regions of the country. So Alabama is doing better in terms of having a higher number of higher paid people in registered nursing programs coming out of WIOA than the national average. And that's why I think you see the high industry earnings in hospitals, because those nursing wages are actually the highest of all of these training programs. Then looking by race and gender, I would ignore the American Indian and Alaska Native for now, probably because there's a low number in that category, although I don't have the data at my fingertips. But I would just take that with some suspicion because it could be just a really low number of people. But I would say looking at between the Black and white categories, there's not as much difference in Alabama as there is nationally. Nationally, Black women earn almost half of what white and Asian men earn. Although here you see that in comparing the Asian men and Black women, basically. But that's true also for white men nationally, that there's much higher earnings. So there's less disparity. On the other hand, if you look at these annual earnings, they're pretty low generally, and that's true nationally as well. Yeah, because the median income, for example, in Birmingham is around $58K. So that's all I have in terms of just showing you the data. And I thought it might be worthwhile to have a conversation with some questions. I can't necessarily hear you, I guess. I didn't think about that. But it might be worthwhile to have sort of a Q&A about how to make sense of, what are the programs you want people to be trained in, especially in a digital economy that is likely to have a lot of automation into the future. And also how, perhaps these low wage workers that we're talking about, a lot of them are in hospitality and leisure, which has been highly impacted in the pandemic. And so, what does that mean in terms of reemployment for people? So I'm seeing some questions in the chat, which is really great. What type of policies or laws could lead to more participants going into training? Well, actually, I would argue that based on the evidence that I've seen on WIOA training, because the training is generally short term, like 6 weeks on average, and the amount of training under WIOA is on average around $2,200. And the outcomes are not, there's not much evidence that the outcomes for WIOA training are better than people who didn't receive the training. However, the outcomes for people who received one-on-one career services nationally are much higher. And so especially in this recovery period where you're seeing, likely a large share of hospitality and leisure workers who generally have lower education backgrounds, they're going to have a hard time getting another job in hospitality, perhaps until things fully open, or until demand some of them will be going back as you reopen, but it may take a while for others. And so there might be a large share of those folks who need to go into another industry. And that is where you really need that one-on-one career counseling to help people transition ideally into a better quality job. And I would say in general, to the extent that you can offer earn and learn opportunities like apprenticeship and customized training, usually those wages are better. On the job training is a little bit different because it's usually usually at the front end for entry level jobs. But those jobs where you can actually train someone a little bit farther along in a work-based setting generally have higher earnings. So that would be my advice in terms of state policies generally, is to focus on more one-on-one career services. What are some policies that could help ensure people are not going into lower wage job after exit? Great question. So Alabama is doing better than this than other states, as I showed you, because of the registered nursing. I didn't do any qualitative research in Alabama, so I don't know why Alabama has higher RN share. You may know that more than I do. But I would say I did some research in Florida because they had the highest share. They had they're about 20% of national RN completers. And what I found there was not anything special in terms of what was happening in terms of just direct career one-on-one counseling. What I saw is that they were intentionally going to RN orientations to advise them that they had a pot of money that people could use either in some cases, to cover the whole RN training if there was a public provider that was affordable under the allowable allocation. But in most cases, because those providers were private and it was costly, they would offer to cover the last semester, or even in some cases, because if the student was full-time and they had student aid, they could offer to cover all the supportive services in the RN program, not the training itself, which would help the student with laboratory expenses, books and equipment and things like that, which is important, and just help people complete as opposed to necessarily being able to fund the whole thing. And this is something that I'm trying to say nationally with people on the Hill, that, it's really complicated for local areas to have to cobble together multiple sources to provide these wraparound supports, equipment, and training. And it would be great if there was flexibility to offer that as a bundle, so someone to get them up to that RN level. The other thing that Florida was doing, which might be happening in Alabama too, is working directly with employers in the hospital system to take the existing CNA folks and get them upwardly mobile into those RN positions. And another option is to think strategically about, setting policies where you maybe don't allow workforce funds to be used for the very, very entry level trainings. And so you're basically expecting employers to cover that because if it's entry level, it should be entry level. And then offering funding for the next level up. So that kind of incentivizes more of the funding to go towards upward steps that have higher earnings rather than sort of a cycle of just kind of subsidizing the lowest earnings jobs. It can be tricky because employers often have high demand for those jobs because they have high turnover. But it could be a way to sort of negotiate with employers or set a timeline, like we'll do it this year, but next year we're going to start doing it another way to try to get that public funding used to give people better jobs and improving upward mobility rather than just sort of getting people in the door. Because ideally, if it's entry level anyway, it should be actually entry level. Where's the data from truck driver wages from? The data are calculated, so it varies, but the first data set that every state has to use to calculate earnings data is from the UI wage records system. So when employers quarterly are required to report their earnings to the state, then the state gets that data, it's cleaned up, and then it's used to calculate performance in WIOA. It's important to note that self-employed individuals and contract laborers and others are not included in the UI wage records. So in most states, or even actually local areas, there's a lot of effort taken at the local level to actually do quite a lot of follow-up with the participants to verify their earnings as well. And states can choose to use, like private data sets, like Equifax to get supplemental earnings wages to add to the earnings data that is submitted to DOL. This is the national reporting system that I'm gathering this from, which is a public use data set that anyone can download. What are some programs that can be braided with Title I programs to provide supportive services? That's great. Well, Title I programs do have supportive services and do fund supportive services. And in some states, they try to not fund any training at all and just use more of their WIOA allocation for those supportive services like childcare or transportation, or in some cases, like if you're working with out of the court system, you might want to fund mental health services for the reentry population, or CBT, mental health services, substance abuse services. So there are, that's where it gets tricky as far as integrating data across these different agencies and programs within your state data systems, so that if someone is speaking to a job center frontline worker, that worker has some way to know, like if someone's entering information about their income, et cetera. Oh, you might be eligible for this program over here in mental health, or this program over here for childcare, or SNAP, et cetera. Most states, I don't actually know the details about Alabama, but most states don't have data systems that are integrated to the extent where they can actually do streamlined eligibility. I'm actually currently working on a report to promote more federal standardization of data across programs through standard data dictionaries. That's my main recommendation at the federal level, because then the state, if the data are collected in similar ways across programs, it's easier for the state to then try to link the data in their data systems. But right now we're kind of a long way from being able to integrate data that way. So, I think data integration is a challenge for aligning and coordinating services at the local level. It's, because the individual also typically needs to move from one office to the next, do the intake form there, go to a next office, do the intake form there. And they're basically entering the same information over and over, which can also be, psychologically challenging, because if someone is experiencing homelessness, and they're ashamed of what's happened to them, or, whatever the barrier is, then they're having to sort of report the same traumatic information over and over and over again, and it can be pretty dehumanizing. And so that's why I'm interested in speaking at the federal level around digital transformation in data systems across programs and agencies, because I think it's really hard for especially the most barriered populations. The data the data I'm telling you about is the data that's reported to the feds. Yes. So this is what happens is the data from the state goes to DOL. DOL contracts with my former employer to clean and process the data. And then that gets into a public use file that's available on the DOL website. And this is Q3 2018. It's released. Generally, the public use files go up every year. So you can, I think 2019 is up now. Unfortunately, what it means also, because of the wage records that are delayed, usually 6 to 9 months, we won't know what the pandemic situation is probably till next fall or after in terms of being able to look at the data. It'll be a while. And so that's kind of a problem with our data systems also. And that's another recommendation I have for the feds is we should actually, change how employers report their wages and earnings, because it's quite onerous on them. And, there's a group called T3, for example. They have a JetX initiative where they're working with employers and payroll providers to try to figure out ways to standardize and automate how employers report that information into wage records. So that way, if we got more frequent data and more accurate data, more complete data with less work on the employer side across states, then we would know a little bit more about what's happening in the labor market, especially in a crisis where you kind of want more real-time information. We just get our SLDS. How would I set up yours? That's a good question. I would need to know a little bit more about your system. But what I would say generally is what I've seen is that most states design the case management systems and decide how to collect the wage and earnings data from employers. And that's typically in one is in the UI division in most states, and one is in the workforce division or labor division. Some states have that integrated, but in most states it's separate. And that can be a challenge because under WIOA, education providers are required to report wage record, outcomes data in order to be on the ETPL, the eligibility training provider list. And so that's been a tremendous challenge nationally, because getting the access to those UI wage records for the providers, for all the students, not just the WIOA funded participants in that program, makes it onerous for the providers to stay on the ETPL. So there have been waivers in most states because even the community college systems don't have access to the data, the wage data. And again, the wage data has a lot of missing data, which is problematic when you're talking about low wage workers who are doing, often a lot of gig work and a lot of self-employment, et cetera. So what would I suggest in terms of data systems? I mean, the first thing that I think what states could start doing, even before the federal government, is trying to work across agencies to establish basically an interagency task force that can establish a standardized data dictionary. So that way, for example, how you collect someone's name and the format of it, and how you treat, 3 last names is the same in, SNAP versus WIOA versus, the health system. So that the way that the common data elements that are generally across the systems collected is more standardized, and that the definitions are there. And then, just having a blueprint and a framework for how, where is the data coming from in each of these systems and how is it shared? it's very challenging to share data under the current privacy laws, because a lot of them are from the 70s, before we had the internet, let alone things like apps, and platforms. So there really needs to be federal action, I think, on the privacy law front in order to really look at, how do you design and support states that want to build integrated systems in a way that doesn't, that is compliant with these multiple laws in different parts of the government, and also up to date for how data is used today. But there is a lot that states can do. The most innovative states in this crisis that we're dealing with, and I'm sure this is true in Alabama as well, just like surges of UI claimants, they would use cloud solutions to stand up a front door for those participants, the intake forms, so that it didn't overload their servers. And instead of investing in wholesale data transformation efforts, like a vendor that does a system from start to finish over a 5 to 10 year period, often what happens is those projects fail to deliver on time, on budget, and in good quality. Instead, focusing on setting up your state to basically focus on continuous improvement. And that means having more state internal capacity for data systems, and smaller procurements in shorter time periods for smaller pieces, rather than just sort of a wholesale ownership out to a vendor. I'm happy to talk more about that if people have questions. And then I know it's 10:35, so I'll try to answer the last question quickly. Did I understand correctly, we are spending 84% on classroom trainings and only 16? Yes, that's pretty much what I saw. I can pull up the slide again. It's 84.6 on occupational skills training, and 15.4% on the job training. And like I said, in many states, there's like 10 other categories of training. So you could spend it on customized training, apprenticeship training, although that's tricky with performance measures, but I could talk about that if people want to know. Other kinds of training, subsidized employment. Like if you're working on formerly incarcerated, you might want to focus on things like subsidized employment, which you can spend about 10%, up to 10% of your allocation on. And I would say customized and apprenticeship have the highest earnings overall. Yeah, training tied to work is has better completion generally, especially when there is some access to career counseling, which WIOA provides. And usually the earnings nationally are about double. This makes sense because a 6-week training for a CDL, it's just a license. It's important, but it's just to get in. A 3 or 4 year apprenticeship makes you somebody that is a middle earnings, puts you in the middle class, basically. You become a professional in your field. And so, whether that's in the trades or whether that's in cybersecurity and tech, that on-the-job learning in many jobs, including healthcare, like RNs, in many cases, there are many employers that need someone that has experience in their industry, not just the classroom education. It's in lots of occupations like cyber. If you just do it in the classroom, you're like, you don't really know how to do your job. But if you have the experience trying to solve cybersecurity problems in the job environment that you're in, whether it's healthcare, county government, or finance, industry, which is all very different. That valuable industry experience is really important and actually lacking in most places in the US because we don't have that pipeline of apprenticeships and other applied learning opportunities for people. I'm happy to make the slides available to people. The other recommendation, like I said, is to focus, especially right now, on more one-on-one assistance for people, because that's how you can make sure that people are connecting with other services they may need more effectively, and that the person is aware of what their options are in the labor market outside the industry that they're used to. You know, transitioning to another industry can be really challenging because you don't have that first job in that industry. You don't have it on your resume. And in terms of quality jobs, not just sort of, you know, any job. So I think I should probably stop there and let, because I know the time I'm a little bit over. So I will end it. But thank you so much for having me. It's been a pleasure. Oh, one more. Okay, I can make the slides available for sure. I don't see the question. I'm not seeing a question. So, oh, should case management for supportive services be integrated into WIOA programs? That's a good question. So, WIOA programs allow supportive services. In other words, you have a case manager when you're enrolled in WIOA and individualized services or training. And so that person can, you know, oversee to what extent someone is enrolled in something else. Although, again, it's hard because they're not often not having access to the data like in SNAP or whatever. But in some states, it's possible to, you know, like if you have a partnership with SNAP in Ohio, what they've done is they have developed with a grant, they integrated TANF and SNAP ENT with WIOA. And so all the WIOA youth generally were co-enrolled in either SNAP or TANF ENT. And they did that as a way to, because youth, you know, out of school youth tend to need a lot of services, and the WIOA allocations aren't high enough to properly serve that person from start to finish. And so they just launched a very coordinated effort in Ohio statewide to integrate and braid those two funding streams with grant funding. So there's information, you know, you could look up on Workforce GPS on how Ohio did that and what the challenges were in terms of benefit cliffs. I know the Atlanta Fed is also working on benefit cliffs. And so that might be worth seeing if you're interested in trying to, like from a statewide, encourage co-enrollment, especially for the most barriered populations. I think it's a really good idea. And in that case, someone could have one case manager instead of having to see more than one, depends on how the program is designed. So I hope that helps. Thank you so much for having me. And I hope this was insightful and useful for discussion.
Virtual. We sent her a virtual thank you. I will send the rest of the slides. I know that's a lot of heavy material. WIOA is a complicated topic, but we're all